Hi, my name is Izazi, and I am a pharmacy student studying in University Brunei Darussalam. This video is about mouth ulcers and oral pain relief. I will talk about what is mouth ulcer, what causes it, and how to treat mouth ulcer with oral pain relief. What is mouth ulcer? Mouth ulcers are also known as canker sores or aphthous ulcers. They appear as red, yellow, or white color sores, and they form inside the mouth, either on the tongue, inside the lips, side of the cheeks, gums, and roof of the mouth. Anyone can have mouth ulcers, but they are more common in females and teenagers. Mouth ulcers are not contagious and different than cold sores and oral lichen planus. Cold sores are contagious. They form around the mouth, on the lips, or anywhere on the face. Usually have itching, tingling, and burning feeling when they start to form as blisters, and those blisters may burst and turn into a scab. Oral lichen planus is not contagious and can be found as white patches with lacy pattern that usually form inside the cheeks, gums, and tongue. Types of mouth ulcers. There are three types of mouth ulcers, and they are minor, major, and herpetiform mouth ulcers. Minor mouth ulcers are the most common out of the three types. They appear round or oval and are smaller than 1 centimeter in diameter. You may have 1 to 5 ulcers at a time, and they can change in size. Major mouth ulcers are less common. They have deeper and larger sores, more than 1 centimeter in diameter, that may appear up to 10 ulcers at a time. Herpetiform mouth ulcers are the least common. They are pinpoint-sized ulcers that appear between 10 to 100 ulcers at a time. Both major and herpetiform mouth ulcers are more severe and really painful. Eating and swallowing may be difficult, and is advised to go and see the doctor. Next, let's take a look at what causes mouth ulcer. There are many causes that may lead to mouth ulcers to form. Mouth ulcers can be caused by small injury, such as accidental cheek bites or sharp braces, emotional stress, certain foods, hormonal changes related to menstrual periods, unbalanced diet, as well as because of side effects from medications taken. So how to treat mouth ulcer? Unlike the other two types, minor mouth ulcers heal on their own within 1 to 2 weeks. However, the pain may be uncomfortable, and so there are ways to help relieve the pain at home by avoiding things that may irritate or make the mouth ulcer worse. When having mouth ulcers, avoid eating foods that may hurt, those that are hard, crunchy, sharp, acidic, salty, and spicy foods. Instead, eat foods that are soft. Brush gently with soft toothbrush, careful of the mouth ulcer, and avoid irritating or harsh toothpaste containing sodium lauryl sulfate. One way to help soothe mouth ulcer is by rinsing with salt water mouthwash. 1 teaspoon of salt dissolved in a glass of warm water, and gently rinse the mouth several times per day after meals. Make sure to spit the water out after rinsing. You may also take medications to relieve mouth ulcer at home. The medications may be in the form of dental gels, paste, mouthwash, numbing spray, ointment, and tablets. An example of dental gel is Oragel Pain Relief. The generic name is choline dental gel. Oral gel can be easily found in local shops and drugstore around Brunei. It can be used to heal mouth ulcers, infant teething, denture irritation, sore gums, cold sores, and braces discomfort. How to use it? With clean finger or using a cotton bud, gently rub a small amount of gel about 1 centimeter onto the affected areas. You may apply 2 to 3 times a day after food or may repeat every 3 hours. Oral gel can also be used for children, but do not use more than 6 applications in 24 hours. And oral gel is not recommended for babies below 4 months old. Oral gel will relieve the mouth ulcer pain fast within minutes, and the mouth ulcer will heal quickly within 1 to 2 weeks. What are the precautions when using oral gel? Do not apply more than 3 times hourly for infant teething pain. Do not take or give aspirin to children when using oral gel. Do not use oral gel when taking medicine for blood clots or gout and if you have stomach ulcer. And breastfeeding mothers should try to avoid using this product. How to store oral gel? Store oral gel below 30 degrees Celsius, protect it from light, keep kept tightly closed after opening, and keep out of reach of children. When to see the doctor? See the doctor if the mouth ulcers last longer than 3 weeks, becomes larger, and if more ulcers are formed, becomes more painful even after self-treatment, which leads to eating and swallowing becoming difficult. This may be a sign of mouth cancer, major or herpetiform mouth ulcers, so it is best to see the doctor as soon as possible for early treatment. How to prevent mouth ulcer? See the dentist and ask for orthodontic waxes to cover any sharp edges for those who are wearing braces. Maintain good oral hygiene and brush gently with soft toothbrush. Chew food slowly and carefully to prevent accidentally biting the inside of the cheek. Avoid eating sharp and hard foods. Eat a healthy and balanced diet. And try to stress less and sleep 7 to 8 hours. Now, before I end the video, I have 3 questions for you. True or false? These are the 3 questions. Feel free to pause and answer them. The answer for question number 1 is false. Minor mouth ulcers are the most common out of the 3 types and appear 1 to 5 ulcers at a time. For question number 2, the answer is true. Do not use more than 6 applications in a day for children, and oral gel is not recommended for babies below 4 months of age. Number 3, the answer is true. It is important to see the doctor to get early treatment because long-lasting mouth ulcers may be a sign of mouth cancer, major, or herpetiform mouth ulcers. And that's the end of my video. Thanks for watching and have a nice day!